Hi, my name is Dr. Angela Kenzslowe. I want to take a moment and express to you what EMDR is and how it can help you. EMDR, eye movement desensitization and reprocessing, is a psychotherapy that enables people to heal from the symptoms and emotional distress that are the result of disturbing life experiences. Repeated studies show that by using EMDR therapy, people can experience the benefits of psychotherapy that once took years to make a difference. It is widely assumed that severe emotional pain requires a long time to heal. EMDR therapy shows that the mind can, in fact, heal from psychological trauma as much as the body recovers from physical trauma. When you cut your hand, your body works to close the wound. If a foreign object or repeated injury irritates the wound, it festers and causes pain. Once the block is removed, healing resumes. EMDR therapy demonstrates that a similar sequence of events occurs with mental processes. The brain's information processing system naturally moves toward mental health. If the system is blocked or imbalanced by the impact of a disturbing event, the emotional wound festers and can cause intense suffering. Once the block is removed, healing resumes. Using the detailed protocols and procedures learned in EMDR therapy training sessions, clinicians like myself help clients activate their natural healing processes. More than 30 positive controlled outcome studies have been done on EMDR therapy. Some of the studies show that 84 to 90% of single trauma victims no longer have post-traumatic stress disorder after only 3 90-minute sessions. Another study funded by the HMO Kaiser Permanente found that 100% of single trauma victims and 77% of multiple trauma victims no longer were diagnosed with PTSD after only 6 50-minute sessions. In another study, 77% of combat veterans were free of PTSD in 12 sessions. There has been so much research on EMDR therapy that it is now recognized as an effective form of treatment for trauma and other disturbing experiences by organizations such as the American Psychiatric Association, the World Health Association, and the Department of Defense. Given the worldwide recognition as an effective treatment of trauma, you can easily see how EMDR therapy would be effective in treating the everyday memories that are the reason people have low self-esteem, feelings of powerlessness, and all the myriad problems that bring them in for therapy. Over 100,000 clinicians throughout the world use the therapy. Millions of people have been treated successfully over the past 25 years. EMDR therapy is an 8-phase treatment. Eye movements or other bilateral stimulation are used during one part of the session. After the clinician has determined which memory to target first, he or she asks the client to hold different aspects of the event or thought in mind and to use your eyes to track the therapist's hands as it moves back and forth your field of vision. As this happens, for reasons believed by a Harvard researcher to be connected with the same biological mechanism that's involved in REM or rapid eye movement sleep, internal associations arise and the client begins to process the memory and disturbing feelings. In successful EMDR therapy, the meaning of painful events is transformed on an emotional level. For instance, a rape victim shifts from feeling horror and disgust to holding the firm belief that I survived it and I am strong. Unlike talk therapy, the insights clients gain in EMDR therapy result not so much from clinician interpretation, but from clients' own accelerated intellectual and emotional processes. The net effect is that the client can conclude EMDR therapy feeling empowered by the very experiences that once debased them. Their wounds have been not just closed, they have been transformed. As a natural outcome of EMDR therapeutic processes, the client's thoughts, feelings, and behaviors are all robust indicators of emotional health and resolution, all without speaking in detail or doing homework used in other therapies. I welcome you to reach out to us so we can see if we're a good fit and we're able to work together to help you towards your healing. Thank you so much. Again, my name is Dr. Angela Kenzslowe.